Hi there. We are here today with Dr. Timothy Speicher of the Positional Release Therapy Institute. What is the success rate of the Positional Release Therapy Institute clinicians treating conditions patients present to you with?
Let me speak on a larger context in regards to success rate. So positional release therapy, it's kind of the new sort of grown up version of an older therapy known as strain counterstrain or counterstrain. And you'll see research kind of mixed. You'll see some studies that are very much dedicated to positional release therapy, some that are dedicated to our particular approach, utilizing the fasciculatory response method. And then you'll see some still utilizing the old technique from the 1950s. And so you'll see research on both sides. But regardless of which side you look at, both are producing superior therapeutic and patient outcomes. There is tons of research in this field and has been around since the 1960s, early 60s. And for clinicians out there, they'll quickly understand where this falls because internationally, we are sort of the consensus is we're kind of falling on the B- sort level. That's a sort of strength of recommendation, like, should you use this therapy? And that's based on quality studies that are done, a variety of studies. There's been RCTs and meta-analyses and case series designs and so forth. So there's a huge body of research that shows the effectiveness of positional release therapy. Now, here at the Institute, we do our own research on a day-to-day basis. We are constantly engaged in clinical-based research. We're getting ready to launch a randomized control trial. I'll just give you a quick example. One of the therapies which we teach, a protocol, it's called the wheelhouse protocol. It is our approach for essentially curing, quote, curing non-specific chronic low back pain. A lot of people have low back pain. We have been effective in essentially eliminating chronic low back pain within 3 treatments, 3 one-hour sessions. And so our success rate is pretty high. We've been tracking it since 2001. I've treated with this therapy over 5,000 patients, personally myself, and tracking them the best we can. We have about a 3% failure rate. Those are handled a little differently, but most patients are completely pain-free. The large majority are completely pain-free after 3 visits for non-specific chronic low back pain. I'm not talking about like you blowing out your disc type of thing, but that's a general thing for us. We're finding, and have for the last 15 years, that most patients, unless there's something super crazy going on, they're pretty much pain-free within about 3 visits or so. And so we're looking to get that data out very shortly. It's been presented at peer-reviewed conferences about the chronic low back pain. And we have some coming on to examine it with a randomized control trial. And that is a course we teach both online. It's called the Wheelhouse Protocol. And we also teach that as a live course pretty regularly. Yeah, it's a pretty innovative approach to back pain that took me about 15 years to develop and really refine. And it was 2 years ago that we released that protocol and that approach online through Human Kinetics. And we've been teaching it ever since to as many clinicians as we can, because as you may be aware, chronic low back pain is a big deal. It's number one reason why people go on opiates.
Right.
And so if we can reduce that, if we can limit the amount of people with that kind of issue, hey, maybe we can reduce opiate usage as well.